medicine is sort of human expertise encoded in heuristic form, right? Like you take in inputs and then you have outputs, right? And the problem with medicine is like expertise until now, any quote unquote intelligence was limited, right?
Mm.
And as a result of that, you couldn't scale this. Forget about worldwide. You couldn't really scale this to a system, and that's the root of all access issues, right? If I today I were to go and try to find a primary care provider for a cold, I would guarantee you I can't find one today. I
Mm.
mean, I could find one tomorrow or day after, right? Because there's limited resources, right? But if you theoretically think about the fact that it's encoded knowledge and you can scale it across the globe, then it's a problem of scale, right? Which we've solved before. Not we, as in tech has like
Yeah.
tech industry has solved before, right? Because it's a matter of scale and just like blitz scaling, right?
Mm-hmm.
Now
Mm-hmm.
it's a little more dangerous because it affects people, so there needs to be risk-based guardrails around it.
Yeah.
But at the same time, I would also think that a bunch of patients are already putting their data into ChatGPT or Google Gemini or similar, right? So people are already doing it. I think we just need to make it better and put more guardrails around it and like
Mm.
link it with by RAG to some
Mm.
sort of verifiable medical knowledge, right?
Mm.
Because this could be huge, right? Like for
Mm.
example, I'll give you a simple example, right? Where I grew up in India, right? TB, tuberculosis is extremely
Mm.
prominent, right? And the standard workflow was, for diagnosis, you have to get like three sputum tests, etc., etc. Now there are things that can have diagnosed TB with like 100% accuracy in 5 minutes.
Mm.
That completely changes the workflow, right? Because
Yeah.
now you can go from presentation to not even a doctor, right? Someone who's sort of paramedical, right? Like someone with
Mm.
some training, knowing how to recognize the bad stuff, accompanied by an AI agent, right? You
Mm.
get TB diagnosed, and you could get the first dose of treatment all under like 15 minutes, right?
Mm.
Huge workflow issue,
Mm.
right? So I think the mass adoption of AI into clinical healthcare over and beyond what's happening in the back office tasks is going to be uh, uh, in starting off in the low and middle income countries, right?
Mm.
But
Mm.
there's a danger there because, by definition, low and middle income countries won't necessarily have the same rigor of regulations that the US does. So we
Yeah.
not and cannot take advantage of that.